My name's Kline. I'm the co-founder and CEO of United for Global Mental Health, and we're the Secretariat for the Global Mental Health Action Network. It has over 8,000 members in 170 countries. So this week we've been in New York for the UN General Assembly, and the key thing we've been working towards is the UN high-level meeting on NCDs and mental health. On Tuesday night we held an event called No Health Without Mental Health. Well, 7 years ago, we organised the first mental health event at the UN General Assembly. And many of the friends that you see today were with us, including the Director General from WHO.
And it was here at ANGA 7 years ago that I first used the expression, no health without mental health.
We wanted to put mental health on the map. We wanted a conversation at UN level about mental health. This is the first time we are now seeing it in a high-level meeting. Thank you so much. We were joined by world leaders, by UN agencies, by civil society and lived experience activists, by philanthropy, by business. It was really, truly a celebration of where we've come to and where we need to go.
There is no health without mental health.
There is no health without mental health.
No health without mental health.
There is no health without mental health.
I was particularly pleased to hear the nominee for the UN Secretary General position, Michelle Bachelet, talk so passionately about gender and mental health.
Even though I have been president of the Chile twice, I'm a medical doctor. I'm a pediatrician, and mental health has always been one of my priorities.
I can tell you clearly, there's no health without mental health.
It was very inspiring to hear the First Lady of Ukraine talking about the impact of war and conflict on the mental health of people in Ukraine, particularly children, and what needs to be done to address it.
Nearly 10 million Ukrainians are at risk of developing mental health disorders as a result of the war.
It was very inspiring to hear conversations with young people talking about what mental health means to them and what needs to happen.
I do believe that we are a world in crisis. It's not something that can be ignored.
For me, this question really resonates with me in a very personal level.
And when we talk about human rights, we need to think about dignity.
It was an important moment to hear from the private sector. Bill Reddy, the CEO from Pinterest, said,
I'd love to wake up in a world where social media companies and tech companies are competing on their safety records in the same way that auto manufacturers compete on theirs.
In that event, we also heard from African leaders talking very personally about mental health and how it's affected their families.
Myself, I have this experience. I have a brother. He was so intelligent, so ambitious. His unit was attacked, and what he experienced there left him with deep scars.
I don't think we've ever had a UN General Assembly where so many people have been prepared to speak about their personal experiences. That is a sea change in the way that mental health is being discussed, and it really makes a difference.
We're talking about whether people like my brother can live life with dignity, having the same opportunities as anyone else.
I think there's some really important things that came out of this week. One was, of course, we have a political declaration that's been negotiated over months by diplomats with our support and many in civil society to try and get the strongest possible language that we can in order to try and get meaningful change on mental health on the ground.
This high-level meeting is a historic moment. This declaration will not be perfect. Governments have not made all the commitments we would like them to make, but we have only just begun.
The other thing that we've seen this week, which is so encouraging, is we've seen so many governments want to talk about mental health.
And Antigua and Barbuda is particularly pleased to be engaged in this discussion.
And so Japan is committed to contribute.
There is much to say about the French situation.
Over the coming weeks and months, we really need to keep the momentum going. This is not the end, it's definitely the beginning. We need now to take what governments have said here in New York and make sure that people understand that at country level and are able to now demand the changes that governments have promised.
Together, we will once again join hands with all our partners. We will keep advocating for urgent action on mental health. Mental health affects all of us. This is just the start. Let's work together to deliver good mental health for all.